Butang mo ko ng Maritime Higher Education.
As we are about to start our webinar, may I request our participants to please mute your
Saan yung mute? Nakamute ba ako? Mute mo daw.
so that there will be no
Ito lang.
and may I request our co-hosts to watch out so that we will be able to proceed smoothly. Let us imagine, just in 5 seconds, our world without seafarers. Our world could definitely be on a standstill. Our dear Administrator, Vice Admiral Robert Impedrad, our dear TCW Office Executive Director, Vice Admiral Rene Medina, our highly esteemed speakers, dear participants, ladies and gentlemen, good afternoon. Welcome to the webinar on Seafarers' Mental Health. The international shipping is responsible for the carriage of around 90% of the world trade. This we all know. That's why I asked you earlier the question, what would it be if we don't have our seafarers? Shipping is the blood of the global economy, but shipping will definitely be impossible without seafarers. We cannot expect to have an abundant supply of qualified and competent seafarers without concerted efforts and measures to address manpower issues such as their welfare and well-being. Specifically, the mental health of our seafarers. As it is, seafarers' well-being and mental health are vulnerable, and this is compounded with the current situation. With the entire world currently battling the COVID-19 pandemic, which has brought unprecedented challenges as it affects every aspect of our lives. The consequences of this pandemic have been especially devastating for our seafarers who spend many months away from their home, working in challenging conditions, uncertain when they can leave their vessel and see their family, thus making them more vulnerable to mental health issues than the wider population. Hence, as part of the celebration of the Maritime and Archipelagic Nation Awareness Month, or MANAMO for 2021, and in line with the celebration of the 23rd National Maritime Week, and as part of the administration concrete effort to ensure the well-being of our seafarers, we have organized this webinar. And to begin with, I would like to request Jayan to lead us in an opening prayer and to be followed by our national anthem.
Let's put ourselves in the presence of the Lord. In the name of the Father, of the Son, of the Holy Spirit. Amen. Dear God, thank you for giving us the chance to see this day, and thank you for protecting us through the night. May you extend your divine wisdom to our speakers so that they would be able to impart effectively their God-given knowledge to all of us. May they be blessed. They continue to bring their expertise to those who need them. Bless the participants as well so that they would be able to glean the vital information from this webinar. May everything we do begin with your inspiration and continue with your saving help. Be with us today. Fill us with inspiration and energy, and may we be efficient and achieve all we need to. May you bestow your blessings after this webinar so that we may go out and spread what we have learned in the spirit of your love and generosity. In Jesus' name, amen. In the name of the Father, the Son, the Holy Spirit, amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, pero sa silanganan, alam ng puso, sa titip mo'y buhay. Lupang binirang, tuyag ka ng magiting, sa manluluping, di ka pasisigil, sa nagatang tutok sa simoy at sa langit mo pagaw, ay hinagang tula, awit sa pagkayang minamahal. Ang isang ng atawad mo'y tagumpay na nagtitigil, ang bituin at araw niya kailan ang ay magtitigil. Lumanang araw ng warhabit pagsingka, buhay langit sa piling mo. Ang inigaya na pagkay mga akin, ang mamatay ng dahil sa'yo.
Good afternoon once again, everyone. To give us the opening remarks for this webinar, I am
Vice
honored.
Admiral, no? Rene B. Medina.
I am honored to present to you our Executive Director of the TCW Office, Vice Admiral Rene V. Medina, for his opening remarks. Sir.
Thank you, Preska. Good afternoon, everybody. Distinguished guests and resource speakers, Ms. Robelyn D. Lumampao, AMOSOP representative and mental health advocate, the Regional Director of the International Seafarers Welfare Assistant Network, Mr. Jun Pablo Jr., CEO of the Philippine Transmarine Carrier, Mr. Gerardo Borromeo, CEO of Well at Sea, Ms. Jessa Paredes, COO of Happiness at Sea, Ms. Pam Kern, and Master Coach Adit Porto of Life Coaching Philippines. We thank you for your willingness to share your expertise and passion as dynamic advocates for our seafarers' well-being. We know fully well that an industry is only as successful as its capability of maintaining a lively and highly productive workforce. Hence, my view is that having you alongside us in this undertaking concretize our mutual advocacy of addressing the growing concerns with regards to the mental health of our seafarers. To our dear Administrator, Vice Admiral Robert Ipedrad, our colleagues in the MARINA, the Deputy Administrator for Operations, Ms. Nanette Villamor Dinopol, our Deputy Administrator for Planning, Attorney Jane Verpipia, and the Deputy Executive Director of STCW Office, Captain Jeffrey Solon, to our friends and respectable stakeholders who are part of the development and employment of our seafarers, particularly the licensed manning agencies, the Maritime and Seafarer Organization, the Seafarer Associations, and to the main protagonists of this webinar, the indispensable men and women have braving the world seas day and night, the hardworking seafarers who will be participating in today's activity. A pleasant day to all of you and welcome to this webinar of Seafarers' Mental Health. It has been a year and a half since the lockdowns were implemented in our country due to this global pandemic. Industries were affected in many forms, whether public or private, and people struggled in almost every aspect of life, regardless of lifestyle, nature of work, or socio-economic status. Among those who were hardest hit by the effect of this pandemic are our loved ones, our beloved seafarers stranded at sea, away from their families without readily access to support and confidential health care. Today, as we do our best to stand strong against a common invisible enemy, we will delve deeper into the issue of what causes the increasing numbers of seafarers with mental health problems such as depression and anxiety. Together with our respected and highly credible guest speakers, let us educate ourselves on the issue at hand and explore intervention and best practices in pursuit of properly addressing of seafarers' mental health and well-being. As a retired officer of the Armed Forces of the Philippines, I myself had a share of coming across people battling with mental health problems. The leadership and followership doctrine of relationship in the armed forces is not enough. And I am fully aware that it has to be taken seriously as it can seep into a person's overall disposition and functionality, making him, her unproductive, antisocial, or worse, suicidal. Therefore, through this webinar, our objective is to bring the realities of mental health to the forefront of our agenda as an agency. I am certain that in order to counteract this negative phenomenon, we should be able to confront it the right way with the help of our distinguished speakers. My fervent hope is to let this be the start of ultimately cultivating a happy and thriving environment for our seafarers aligned with the needs of our time. So to our resource speakers, we are thrilled for what we are about to learn from you today, more so for the lasting impact it can bring to the Philippine maritime industry. To the participants of this virtual symposium, thank you for taking time to enrich yourself with deeper understanding about our seafarers' mental health. I am in hopeful anticipation of what is to come, a working environment at sea where we exemplify a holistic approach to caring for our workforce and establishing a culture where seafarers are free to verbally express and bear their co-workers' internal struggles. This marked the beginning to end the stigma that surrounds what or who shall be perceived as delicate-hearted, but instead recognizing that we are just vulnerable as everybody else. I am positive and full confidence that we can curb the current statistics surrounding the issue of seafarers' mental health, especially with the assistance of our partner organizations concerned with seafarers' welfare. Again, good day, and I hope for the success of our webinar. Thank you and mabuhay.
Thank you so much, sir, for a very inspiring message. And indeed, we are looking forward for valuable inputs and insights from our speakers. So with that, we will now proceed with our webinar proper with the title, Raising the Awareness on Seafarers' Mental Health and Sharing of Best Practices, with the end view for the administration, that is MARINA, to be able to come up with a harmonized mental health program for seafarers. And we are fortunate to have with us as first speaker a public servant for 25 years. She's a licensed psychologist with extensive background on clinical, forensic, and industrial psychology for 22 years. She's currently the executive officer of the Personnel Division of the National Bureau of Investigation and the concurrent supervising psychologist of the Behavioral Science Division of the NBI. She's a graduate of BS Psychology from St. Paul College of Manila. She took her master's degree in business administration from the University of Perpetual Help and her post-baccalaureate degree in human resource management from De La Salle University College of St. Benilde. She had also finished quite a number of seminars and trainings, both national and international, on organization development and behavioral science. She's a mental health advocate and is a partner of AMOSUP in promoting mental health of its employees, seafarers, and their families. Ladies and gentlemen, join me in welcoming AMOSUP representative, Ms. Robelyn Lumampao. Ma'am, you have now the screen.
Okay, good afternoon. Good afternoon for that very kind, simple, and concise introduction. So, maayong hapon sa tanan. Good afternoon to the officers and employees of Maritime Industry Authority. I would like to thank the administrator for MARINA, Vice Admiral Robert Empedrad, for the invitation, most especially Dr. Conrad Ocaw, who extended the invitation to me and given me opportunity to speak in behalf of AMOSUP. So also this is intended for our seafarers, Filipino seafarers. So maayong hapon sa tanan. Actually, seafarers have been close, they're really dear sa akin kasi I have family members who are seafarers. So I would really love this opportunity to impart my simple knowledge on mental health. So for this afternoon, I have prepared very short lecture or material to give an overview on mental health, its importance, and to share the best practices that AMOSUP have. So, okay. So our objectives would be, number one is to define mental health. What is mental health? Second is to be able to discuss its importance, and of course, to share our best practices. What is mental health? Okay, mental health refers to our cognitive, behavioral, emotional well-being, which encompasses how we think, feel, and behave. So, ito po dapat congruent, thinking, feeling, and our behavior. Okay? So, okay, this is a little trivia. Did you know that in 2000, the World Health Organization identified mental health as one of the major diseases of the 21st century? Major depression is ranked number 5 in the 10 leading causes of global diseases, followed by substance dependence, schizophrenia, and bipolar disorders. In 2010, PSA reports that 14% of the population of 1.4 million Filipinos were identified to have mental disorders. Okay. Fast forward in 2020, the World Health Organization, mental and behavioral disorders account for about 14% of the global burden of diseases, as many as 450 million people who suffering from these illnesses. So the Philippine World Health Organization Special Initiative for Mental Health conducted in the early part of 2020 shows that at least 3.6 million Filipinos are suffering from one kind of mental, neurological, or substance use disorder. Okay. In 1960 to 2006, 1,011 out of 17,026 deaths of seafarers were due to suicide, and that's equivalent to 5.9%. In 1992 to 2007, 590 suicide deaths were recorded out of 4,573, equivalent to 13.1%. 5.7 to 27.5, according to IMHA, were collected reports of suicide on 2012, and 2020 ITF report, 17% of the total population of the worldwide seafarers experience depression and anxiety. Unfortunately, here in the Philippines, wala po tayong data as to the number of suicides and the percentage of Filipino seafarers who are suffering from mental health. So wala po ako nakita sa research, at I think that's where we should also consider. So what are the common mental illnesses of seafarers? Okay, given po yan, stress, adjustment disorders, anxiety, depression, sometimes PTSD. Okay. What is the importance of mental health awareness?
What is PTSD?
I'm sorry? Post-traumatic stress disorder. Sorry po, I abbreviated as post-traumatic stress disorder. Okay, so let's go to the importance of mental health awareness. Number one is to eliminate stigma for these people. Second is education. And third is the improvement for the mentally ill. So that's the reason why we are all here gathered today, to improve the awareness and come up with policies that would help. Yun yung ating hinaharap na 21st century disease, which is mental health. So as per the AMOSIC best practices, AMOSIC started with their psych department sometime 2013. This was established specifically to give services, psych services to its employees, members, and their families. Okay. On 2018, AMSU coordinated with the mental health awareness campaign to its members. Nag-start na po yan because 2016, if I'm not mistaken, there was a convention, a conference of IATF in London discussing mental health to be part of the different programs that we can offer to our seafarers. So we were part of the capacity building program through training the staff of AMSU with psychiatric emergencies and or onboard assessments. And apparently, after a few months, AMSU was able to establish a MedConnect or a telehealth line for onboard members for medical and psych emergencies. At this point in time, AMSU has this continuing education through lectures, seminars to AMSU employees, members and its families, including MAAP students. So awareness campaign pa rin po tayo. And lastly, we would like to consider that mental health is an integral part of health. Indeed, there is no health without mental health, according to the World Health. Just like any other disease, mental health should be spoken freely. Just like kung gusto natin mag-consult sa ating mga sakit sa mga doktor. So this should be openly discussed. So with that, I'd like to thank you for your participation and your time for listening. So maraming salamat po. That's it. Virtual course back to our host. Thank you, ma'am.
Thank you, Ms. Robilyn. Before we go to our next speaker, we would like to ask some question. Considering that AMSU have established a mental health program for their members, what could be your recommendation that you can give us? Because as I've said earlier, we are in the process of crafting a harmonized mental health program for seafarers. What do you think we should consider in crafting this program?
Actually, considering that, well, Philippines, hindi pa ganun ka-popular ang mental health. So first, we should start with awareness pa rin. Okay, just like any other disease, they started with awareness and education. To begin, as far as I'm concerned, the Philippines has good assessment. Okay, assessment as to the mental evaluation of our seafarers. I've learned that in some other countries, ang screening ng seafarers happens every 2 years, the validity, I mean. Unlike here in the Philippines, bago ka sumampa, every time na meron kang kontrata, you will undergo mental evaluation, which is good. I think that's the rule here sa ating bansa. For our seafarers to undergo mental evaluation every after nasasampa sila. Contract, every contract. But in some other countries, ang validity ng mental evaluation nila is 2 years. Kaya sometimes with the gap, hindi natin nakikita yung need nila or yung present mental condition. So with that, that is a good thing that we should support and continue. Second, hindi kasi pa tayo sanay na pinag-uusapan yung mental health. Sa mga probinsya nga po, pagka nakaka-encounter sila ng ganito, imbis na pumunta sa doktor, pumupunta sila sa mga traditional healers or ang tawag natin doon? Albularyo. So doon sila pumupunta kasi hindi rin sila aware. Awareness pa rin, ma'am. Hindi sila aware na they are actually dealing with a mental illness. So hindi rin ganun ka-popular ang psychiatry. Besides, we have only 600 psychiatrists in the Philippines, licensed and board-certified psychiatrists. So if we're looking at we are looking at the statistics, for every psychiatrist, they have to deal with 200,000 Filipinos to give or to support the mental health if we are considering the 120 million Filipino population. As to the registered psychologists naman po, I think approximately we are around 108,000 psychologists, and divided by the population of 120 million Filipinos, we should be able to handle 11,000 Filipinos. So medyo mabigat po to. Lalong-lalo na yung pag-take care natin, supportahan ang mental health ng bawat isa. So ito po, if I would like to again repeat what I had said a while ago, we should start with education. We should start with awareness. Unang-una sa lahat, ang pagpapatingin sa doktor dahil meron tayong kakaibang nararamdaman. Again, think, feel, behave. Okay, yung behavior, nakikita ng mga kasamahan natin na kakaiba or odd. Yung pakiramdam, may kakaiba tayong nararamdaman could be like laging ninenervyos, hindi matulog. So may mga ganon. And yung sa naiisip, hindi kasi nakikita yun eh. We have to get it from our patients. Dahil not like any other illness, na namamaga, may sugat, may bukol, ang mental health po hindi ganon. So, kailangan lang aware ang lahat ng Pilipino na merong kaukulang lunas sa magantong karamdaman. So, with that, awareness and education is very important at this point. To come up with a good policy, to be able to take care with the mental health of everybody, most especially to our seafarers na talagang nakakaranas nito because they're in isolation sa mga barko. Most especially now with COVID, that's additional stress for them. Not just for them, but for everybody around the world. So, still awareness and education, ma'am.
Thank you so much, Ms. Rubilin, for your valuable inputs. We'll definitely take into account your recommendation. Thank you so much.
Thank you so much.
And at this point, I would like to call on our next speaker. We are so honored. I am so honored, sir, that you have accepted our invitation. We have with us no less than Mr. Gerardo A. Borromeo, the Chief Executive Officer of the Philippine Transmarine Carriers, or the PTC Group of Companies. A diversified company with strategic initiatives and business interests in shipping and marine services, real estate, energy and fuel distribution, healthcare, and aviation. He serves as Vice President for External Affairs of the Filipino Shipowners Association and has been reappointed as Vice Chairman of the International Chamber of Shipping. Mr. Borromeo is also a member of the Board of Governors of the World Maritime University in Sweden and serves as chairman of its executive board. For 2 consecutive terms, he served as president of Intermanager, an international trade association of global ship managers, the only Filipino to be elected to this leading post. For his valuable contributions to the Philippine maritime industry, Mr. Borromeo was honored by MARINA with the Timonel Maritime Achievement Award in 2014 and was the first Filipino to be awarded the Distinguished Sea Trade Personality of the Year Award at the Sea Trade Maritime Awards Asia in 2015. A graduate of the Massachusetts Institute of Technology in the USA, where he earns his bachelor's and master's degrees. Mr. Borromeo represents MIT as a regional chair and educational counselor for the Philippines, while also serving as a member of the executive board of MIT Sloan School of Management. Sir, you have now the screen.
Thank you very much, Preska, for the kind introduction. And good afternoon, ladies and gentlemen. Thank you very much for the kind invitation to participate in this discussion on mental health. An important subject, particularly today, as we navigate the many challenges of this global pandemic. It's certainly not the easiest topic to discuss, especially because of the perceived stigma on mental health. And yet, it is not only global maritime professionals who may be affected by wellness concerns. Actually, for all of us, it's important that we get to learn more about psychological wellness and its significance on our lives for us to better manage this growing concern. The French novelist Jules Verne provided a very vivid description of life at sea as follows. The sea is everything. It covers 1/10 of the terrestrial globe. Its breath is pure and healthy. It is an immense desert where man is never lonely, for he feels life stirring on all sides. Let's think about that last line. An immense desert where man is never lonely, for life is stirring on all sides. Anyone who has spent long periods of time in transit at sea, hard at work, might see things differently from Jules Verne. Despite the ocean's beauty that unfolds every day, I can well appreciate how lonely it can get on board. Against the backdrop of vast, cold, harsh, and intimidating oceans, seafarers endure the dangers inherent at sea and the difficulties of being away from home. These conditions make our maritime professionals vulnerable to threats, not just physically, but psychologically. As far back as 2013, a study by Swansea University concluded that the result of despair and an inability to deal with the challenges of life at sea puts the maritime industry almost at the top of the list when it comes to recorded suicide rates, second only to coal mining among all industries. Along these lines, the UK Chamber of Shipping did their own review of such incidents and found that suicide rates among seafarers tripled from 2014 to 2017. I should add that even one such unfortunate event, such as this, is most definitely one too many. Among the many causes of mental illness among seafarers, the following have been identified as primary factors that can trigger such an outcome: stress, harassment and bullying, anxiety, fatigue, disruptive thinking and behavior, and addiction to alcohol and drugs. On the other hand, environmental elements that have been found to exacerbate such conditions were identified to be loneliness, short turnaround times, lack of shore leave, separation from spouses and families, job retention, and long working hours. In this last decade, the expansion or the explosion of piracy and its global visibility on the high seas, plus the high-profile criminalization of global maritime professionals, has added to the extreme pressure that a career at sea can generate. This issue of mental wellness is not new. It's been around for a long time, but has bubbled just below the surface, never making its unfortunate presence felt. But it is a situation that will only continue to grow in numbers as the complexity of life around us increases exponentially. Another driver of stress is the mushrooming phenomenon called social media. This is especially true among seafarers who are adept at using the latest communication technologies. Social media serves as an accelerated contributor to anxiety by making such media followers completely aware of what's happening, problems, and things that are missing at home, all in real time. We describe global maritime professionals as being the heart and soul of a ship, the human element serving as the critical tonnage enabler, ensuring safe, secure, and sustainable shipping year-round. Having such competencies available on demand is in turn what ensures that the shipping industry successfully facilitates global trade, and by association, the very development of humanity. This is an indisputable fact. So for an industry that moves over 90% of world trade by volume, you can therefore see how critically important it is to ensure that the team on board is solid, competent, and situationally alert to all conditions 24/7. The recent unfortunate event of the Ever Given, one of the largest ships in operation today, that created a total blockage of the Suez Canal, is one example of how something can go from good to bad in almost an instant, like taking your eyes off the road for a split second when you're driving. It's in this light that ensuring the total wellness of crew, to ensure that their alert level while on duty is very, very high, that is primordial for our industry. The IMO has put maritime safety at the forefront of its discussions. And while maritime safety and the framework that it has highlights the importance of seafarer competencies, it's the psychological well-being that the IMO now feels is equally crucial. In fact, the theme of IMO's International Day 3 years ago was centered on two hashtags: support seafarers' well-being and good day at sea. The Philippines serves as an important council member of the IMO. And with Filipinos contributing over 25% of maritime professionals worldwide, the responsibility to ensure maritime safety and security lies heavily on our shoulders. We often come across the statistic that at least 80% of all accidents on board are directly attributable to human error. This drives home the fact that for the Philippines to continue to contribute to safe, secure, and efficient shipping on clean oceans, we need to keep investing in our people, in their education and competency, and in advancing their rights and entitlements. But at the very core, in safeguarding their physical, psychological, and psychosocial health and well-being. The Philippine government has taken important steps in elevating this matter of mental wellness with the enactment of the Philippine Mental Health Law, or Republic Act 11036, last June 2018. Integrating mental health care in the public healthcare system and providing affordable and accessible mental health services for all Filipinos are two very important steps taken. Certainly, this law is a springboard for the maritime industry to begin to formulate policies and safeguards on mental health and wellness specific to Filipino maritime professionals. And as you know, there's also in place the amended Maritime Labor Convention, which has proven itself a landmark convention on crew welfare. But all that said, its provisions should continue to be reviewed and expanded to cover all bases as needed and as the situation changes, which will inevitably include the aspect of seafarers' mental health. And you might ask yourself, why not? When a seafarer's seaworthiness is, after all, the very foundation of our industry. As they say, mens sana and corpore sano, a healthy mind in a healthy body. Fortunately for us, RA 11036 and related industry-specific initiatives already in place allows us to not start from scratch. On the part of our company, Philippine Transmarine Carriers, we entered into a joint undertaking with the Synergy Marine Group, one of the fastest growing ship management companies in the world today. And this was focused on enabling better ways and means to address mental wellness issues on board. In May of this year, May 1 to be exact, we jointly launched We Team, an initiative dedicated to supporting the emotional well-being of the maritime community by offering 24/7 confidential counseling in over 14 different languages and dialects, accessible to any and every seafarer across the globe. The program calls for awareness and action by recognizing that there are many signs of stress that could lead to impaired mental wellness: nervousness, forgetfulness, and anxiousness. These could certainly be the first signs of stress, along with frustration and irritability. So are changes in sleeping and eating patterns, loss of concentration, and overwhelming feelings of helplessness. These are all warning signs that should never be ignored. Left unaddressed, stress could very well lead to depression, which literally can compromise a seafarer's condition and putting the entire ship at risk. So if a crew member is noticeably withdrawing from the team on board, having moments of agitation or even rage, constantly enveloped, say, in a cloud of hopelessness or with deep sadness, to the point where their functioningly normal seems impossible, it's time to put up the red flag. The We Team initiative encourages our seafarers not to be afraid to confront their own depression and anxieties on board, offering a mechanism for crew to share their feelings or just giving them a chance to reach out and call a friend. And we are taking steps, and by doing that, we are taking steps to better manage and address potential pressure points. On the other hand, informing superiors of their apprehensions without fear of retribution is also a huge step to helping our maritime professionals find ways to feel comfortable to alleviate the heavy burden that can impact mental balance. Taking advantage of these mechanisms made available should never compromise a career, anyone's career. So if we have more research and information that we can disseminate, if we have the political will and legislation, relevant support systems, training, education, capacity building, we will be well on our way to help lift the stigma on mental health. And this will greatly benefit our maritime professionals in the conduct of their duties and their responsibilities on board, and will certainly help our industry. Let me close by thanking MARINA, our flag administration, our administrator, Vice Admiral Empedrad, and Vice Admiral Medina, for spearheading this drive to what I call slaying the inner dragon that can haunt each of us at the worst of times. By sponsoring the discussion today, bringing together various experts and individuals who share experiences and can offer suggestions, this sets the tone for the Philippines to effectively address this silent but dark plague. For the maritime sector, it's a journey that requires the concerted support of all of us, of all industry stakeholders. Together as one community, we should protect our interests as a maritime nation, first and foremost, by looking out for our fellow men and women in uniform. We owe it to them. We owe it to our seafarers to do everything we can to ensure their safety and well-being when they leave harbor for the open seas. To serve their country, they're serving the international community, and they're also serving the world. We owe it to their children and their families whose hopes and dreams are hinged on the seafaring profession. We owe it to the young people we are enjoining to serve as the lifeblood of this industry. And finally, we owe it to our shared future to give a voice to this issue of mental health, and on that basis, be able to carry on in the best traditions of our maritime industry. Thank you very much.
Thank you so much, sir. That was indeed an inspiring. You draw some kind of a string in my heart with your presentation, and your presentation in itself is already like a recommendation already. It contains already a recommendation as to what we must do. What we intend to do is to come up with a documented, harmonized mental health program as a maritime administration. Is there anything more that you can add aside from what you have presented?
Well, I think what I tried to frame in the discussion was the fact that this is an issue that has bubbled below the surface. It's always quiet. It's what I call a silent killer. And by MARINA, for example, sponsoring discussions and activities like this, what we do is make ourselves comfortable in talking about the issue. And more importantly, we have to make people who are under pressure feel that it's okay to not be okay. And you've seen that in sports recently. Because if we can begin to deal with this ourselves, we can prevent worse situations. And in the shipping industry, safety is of primordial concern. And by keeping people safe, we keep the ship safe. By keeping the ship safe, we continue to allow the shipping industry to move the world. From the Philippine perspective, our global maritime professionals are a big contributor to our economy. So it's very important that we enable them to always stay healthy, to always stay alert, because working safe means they will come home safe. And by working safe and coming home safe, that continuous ecosystem benefits themselves, benefits their families, and certainly benefits our country. And if we have, over the years, been seen as the seafaring capital of the world, if we have been able to develop the seafarer of choice, it is in our best interest that we continue to look for ways and means to assist every individual to overcome this stigma of mental health. So I hope that by talking about it, by continuing to share ideas, to continue to share experiences, all of us will be able to overcome this issue. And as I mentioned in the beginning, it's not just seafarers or global maritime professionals who suffer from stress. We all suffer from stress. I'm sure in MARINA, you all have the same kind of pressure points. But if we can take a step back, if we can smile, if we can reach out and touch a friend, if we know that we can be comfortable in telling everyone, look, I'm not feeling well today, I'm not well. That's the first step to being able to control this idea, this issue. And so the more that we can have these kind of programs, the more you can get people like Pam, Kern, and others to talk about happiness, the other side of the equation, the better off we will be. So thank you again for allowing me a chance to share my thoughts. And later on in the Q&A portion, happy to address any specific questions.
I can't agree more, sir. Thank you so much indeed for the wonderful presentation and the recommendation. And yeah, I am pretty sure our participants would they will be having questions, and we'll give time for you to answer them. Thank you so much, sir. Okay, that was truly wonderful presentation, and it covered everything. I think what we must do, and we will definitely take into account all those that had been shared with us by Mr. Borromeo. Okay, now we move on to our next presenter. We are also fortunate and honored to have with us the Regional Director of International Seafarers Welfare Assistance, or popularly known as ISWAN or ISWAN, Mr. Renato Pablo Jr., whom I call as Pastor Jun. Mr. Renato Pablo Jr. is the Executive Minister of United Pentecostal Church and was the Program Manager of the Maritime Piracy Humanitarian Response Program in Manila since 2013. He was responsible for managing the office and its operation in providing humanitarian assistance to maritime piracy survivors and their families. Since the services of MPHRP moved to ISWAN in 2015, Mr. Pablo has represented the Philippines in other areas of Southeast Asia by managing ISWAN's welfare activities in the region and continuing to provide a wide range of assistance to seafarers with the assistance of the volunteer team that he directs. Ladies and gentlemen, please join me in welcoming Pastor Jun Pablo. Pastor Jun.
Maraming salamat, Ms. Presi. Thank you very much. Thank you for inviting me to be one of the resource speakers of this webinar. And yes, magandang hapon po sa inyong lahat, sa mga kapatid nating nasa Visayas and Mindanao. Maayong hapon ninyo, tanan. Sana kayo ay nasa mabuting kalagayan at ang inyong mental health ay nasa good condition. Well, as Ms. Presi mentioned that I am the Regional Director for the Philippines and Southeast Asia for the International Seafarers Welfare and Assistance Network, or ISWAN. This topic is really just like what mentioned by Sir Dito and our distinct colleagues from AMOSOP as well, Ma'am Robilin. So in the last decades, the maritime industry has been one of the fastest growing sector of the society. And while it is believed that this sector provides an excellent earning opportunities and benefits, studies say that seafarers are more exposed to an array of stress and mental health problems. Homesickness, worry for their loved ones, lack of quality sleep, extreme temperatures, claustrophobia, and heavy seas are some of the most difficult challenges they face daily at sea. And the emergence of the COVID-19 pandemic has only made the situation a lot harder than it already is. So, a research undertaken by medical experts in Italy, Spain, and Denmark revealed that 60% of seafarers believe that their health has not been properly protected at work during the pandemic, and more than half they feel unsafe doing their job. And as vessels are unable to continue with their planned schedules, there is an added worry among seafarers not knowing when they may see their family again, while other seafarers may not be able to join vessels, leading to job insecurity. And as per the key findings on the study of seafarers' mental health conducted by ITF Seafarers Trust and Yale University, 28% of seafarers screened positive for anxiety or depression. Taas po yan, mga kasama. And twice to have suffered an injury at work or illness in the previous year. And according to the study as well, that 20% is reported with suicidal ideation or suicidal thoughts on several days or more during 2 weeks prior to the survey. So the 35%, according to the study, 35% of them suffers with depression. And the sad part is they don't ask for help. So that's part of the study. So what are the key determinants of a seafarer's depression and anxiety to us? According to the same study, a non-caring company culture, violence at work, or low job satisfaction, and self-rated health problems are the most notable reasons. We also have a lot of seafarers who are stranded at sea, up to 200,000 as of June 2021. And according to the International Labor Organization, or seafarers who are unable to board a ship. And it is necessary to understand the challenges and hardship they are currently facing. So according to another study of the World Maritime University, the majority of respondents reported serious impacts of the pandemic on crew changes and ship-shore interactions. Respondents' experiences varied with regard to the extent to which the pandemic had affected their employment or non-work life on board and access to supplies. And almost half of them reported an increase in workload in comparison to their workload prior to the pandemic. This is where the organization like ICE1 come in. ICE1, or the International Seafarers Welfare and Assistance Network, is a charity organization that is dedicated to the relief of need, hardship, or distress among seafarers of all nationalities, races, color, and creeds, irrespective of their genders. We are a registered organization in the United Kingdom, and the regional program here in the Philippines continuously provides its welfare services to the seafarers and their families. As part of our commitment to dedicate ourselves to efficiency as a charitable institution, I'm going to share with you some of our best practices or methods which have been through rigorous testings that are found to be the most efficient way to help our beloved seafarers cope up with tough times. First is, let me tell you about the brainchild program of ICE1, and that is, we call it SHIP, Seafarers Health Information Program. We have developed a range of resources to help seafarers manage and cope with low mood, stress, fatigue, and maximize their overall psychological well-being. Through this program, we are guiding seafarers on how to make simple precautions to reduce the chances of being infected by or spreading COVID-19, and how to be fit on board, how to maintain good dental care, how to handle food safety, and making healthy, nutritious food to improve the overall health, and most especially on taking care of their mental health. And to maximize their overall psychological well-being, our resources for seafarers includes a series of 3 self-help guides, a range of mental health and well-being infographics, and an audio relaxation exercises. These guides were reported to have been downloaded by Filipino seafarers around 1,200 times from May 2020 to August 2021. I mean, May 2021 up to August 2021 alone. So which proves that many seafarers are indeed suffering from various mental health issues and are needing help. These 3 self-help guides includes the steps to positive mental health, psychological well-being at sea, and managing stress and sleeping well at sea. The steps to positive mental health, it details some skills or exercises and coping strategies to help the seafarers deal with their emotions when life becomes stressful or when their mood is low. It talks about facts versus opinions. Talks about mindfulness, positive coping statements, and the helicopter view worksheet. Another is the managing stress and sleeping well at sea. This help guides provides guidance and information on fighting the negative effects of stress, the controlled breathing techniques, ideas for managing worries, coping when things are difficult, and getting the most from our sleep, among others. So, maganda po yung mga guides. And the last is the psychological well-being at sea. This guide aims to explain what positive mental health and psychological well-being are, and help them to recognize the risk and other things. No? So positive emotions, positive relations to others, and finding meaning and purpose, and identifying strengths and accomplishments are some of the relevant topics that covers these help guides. So ICE1 Philippines was able to provide around 1,700 copies, printed copies, from May this year up to August. We have provided around 1,700 printed copies of these mental health guides and distributed to companies and directly to the seafarers. We also provide, as part of the program, we also provide pre-departure orientation seminar to seafarers through their manning agencies, which is facilitated by myself and other colleagues in ICE1. In a span of 4 months, we have reached around 1,342 seafarers, and there were instances when their family also joined in this webinar or this presentation. So ICE1 also has an on-call regional psychologist, which does 2 things. First, they provide the paid training for ICE1. And second, they provide clinical support when requested and needed. So dito natin sa kanila ipinapasa yung mga seafarers natin na nangangailangan ng professional help. Meron po tayong on-call na psychologist dito sa ICE1, dito po sa region ng Pilipinas. And along with the PDOS talks, the region is also involved in webinars and interviews. Webinars being done twice a month, and we're also broadcasted by the social media page of the hosting shipping company. So with the regional Facebook page, the aim is to make the information available to many seafarers. I really believe in our earlier speakers na binabanggit nila na napakahalaga ng awareness and education. At sabi ni Sir dito, ito ay nag-emerge na silently, no, na kailangan maging seryoso tayong pagtuunan ng pansin ito. So along with that Facebook page sa Facebook page yung mga information ginagawa namin is to make this information available to many seafarers, and it becomes easy for them to access that. The regular training on mental health is another activity included in its repertoire of welfare programs made by the region. These trainings are held every month and have recently gathered around 88 seafarers who were trained and certified during the last 4-month period. So ito po yung mga seafarers wherein they are trained to be aware of their mental health and trained to support other, especially kapag sila ay on board, which I taken noted the earlier speaker natin, sabi niya na mahirap minsan ma-monitor ang mental health ng mga seafarers in between the re-embarkation hanggang sa matapos yung contract. So mahirap ma-monitor nga. Pero kung pagkasama nila sa barko ay marunong ika nga tumulong o sumuporta, so we can ensure that this awareness will be shared to those in need. So on top of these activities, ICE1's 24/7 helpline, which is the Seafarer Help, which provides emotional support to seafarers who contacted us, and signposting them to the regional counselor of ICE1 and to professionals if needed, a clinical intervention. So this helpline is also awaiting for seafarers who wants to talk. You know, it's a confidential helpline. So they can discuss anything that troubles them or what they make them worry. So our helpline colleagues are all trained and they can provide emotional support. And they can signpost cases or let's say instances that the seafarers that they see na kailangan ng professional help. So sina-signpost agad nila yun sa mga available partners natin. So in closing, I would like to remind that in ICE1, we have a lot of resources in which for free for all the seafarers. They can download all those materials on the website and they can use our helpline, the 24/7 helpline. And these resources are dedicated to combat this depression and anxiety among seafarers. With that, maraming salamat sa pagkakataon, maraming salamat sa opportunity, at naway patuloy tayo magtulong-tulong para ang stigma sa mental health ay ating pong malabanan. Maraming salamat po. Back to our host, Ms. President.
Thank you so much, Pastor Jun. I have heard the word "stop the stigma." I think we'll just have a discussion on this as to how are we going to destigmatize the issues on mental health among our seafarers during our open forum. Thank you so much, Pastor. With that, we move to our next presenter. If you would want to do some kind of stretching, it's all right. Just don't leave. This time we would like to call on the Chief Operating Officer of Well at Sea, Ms. Gisa Paredes. She's also a licensed psychologist. Gisa lead the design and implementation of the Well at Sea program, which has now reached more than 10,000 seafarers globally. Over the course of the pandemic, Gisa and her team designed a COVID care package and quality quarantine program to safeguard the physical and mental well-being of crew. Ladies and gentlemen, join me in welcoming Ms. Gisa for her presentation.
Hi, Ms. Preska. Thank you. Good afternoon, everyone. I hope you can see my presentation. Can you kindly confirm, Ms. Preska, if it's showing?
Yeah, we can see it.
Okay, perfect. Oh yeah, so hi again. My name is Gisa Paredes. I'm a psychologist, and as introduced, I'm also the COO of Well at Sea. So today we were asked to, talk about our best practices in the industry and basically a lot of the work that I do, sorry, I'm having technical difficulties here. Yeah, a lot of the work that I do is really to be able to make health accessible to as many people as possible. And I do that in different ways. One of them is through Well at Sea. Okay, so in the maritime industry, I can say that I'm a proud Filipina who has designed a mental health solution for seafarers globally, reaching more than 10,000 seafarers, more than 350 ships today, 16 different nationalities across 7 fleets, which I will tell you more about in a while. As I said, my approach has always been, towards health has always been, preventive. And these techniques are often used to delay the onset of disease or to minimize its impact. This is why the Well at Sea program was designed to safeguard the mental and physical health of seafarers through interventions that are gamified to enhance motivation towards what we call a higher level of wellness. Okay. Now, before I go further into Well at Sea as a solution, it is important to understand the state of our health systems today. So earlier, our first speaker and psychologist, she already highlighted, the fact that there is really there is a lack in mental health professionals and health professionals in our country. So in the Philippines, we see that there is 1 doctor to every 26,000 people, according to the DOLE. And the global average is actually 1 doctor to every 6,000. And when it comes to mental health professionals, there are 2 to 3 for every 100,000 persons in the Philippines. In the 2011 bulletin published by the World Health Organization, we discovered that there are large deficits in full-time mental health staff in low and middle income countries, including our own. So knowing this, I ask you, how are we behaving towards health as an industry? Are our solutions reactive? And how are we considering sustainable growth and learned health behavior in crew welfare? You see, health behavior is a product of culture. In my graduate studies, I looked into the health behavior of Filipinos in relation to weight loss. And my findings showed me that the cultural influence had a lot to do with how health was perceived and approached. Further observations in the maritime industry have revealed that as an industry, we've actually taught our crew to, look for fit to work stamps. So regardless of the approach and understanding of their well-being, it's showing us that we have resorted to teach crew to aim for the bare minimum. So what then can you consider when you talk about crew welfare and mental health? Well, science tells us that treating mental illness will not promote health. So we need to do away with reactionary disease models and build on the attitudes and habits of crew to take responsibility and control of their vehicles for change to become sustainable. You see, like a car, mental health can best be described as a total behavior, wherein it manifests in our thoughts, our actions, our feelings, and our physiology. Earlier, our first psychologist already mentioned this, right? And in order to maintain the car, we need to make sure that the driver's needs are met in ways that the four wheels of the car can support it. Okay? So Well at Sea, our company, is a 4-year-old startup. And we joined the maritime industry in 2017 when we were commissioned to design a program for crew on board. The program is hinged on 3 key pillars. We have a social platform, there's a gamification aspect, and a reward system. And these are meant to support our main goals to increase mental resiliency, physical strength, and socialization. Because as you see, mental health is present in all 3. It is present in the psychosocial elements of a person. So using evidence-based techniques like cognitive behavioral therapy, positive psychology, trans-theoretical models of behavior change, choice theory, and solutions-focused approaches to health, the full solution really offers crew a guide to learn more about themselves through, self-monitoring, some sort of reflection exercises, a workbook that was designed for them, and to be able to create group cohesion and bonding on board ships. So how do we address mental health, and what have we seen amid the pandemic? In early 2020, before we all went into lockdown, we knew that the ships were already facing challenges due to COVID, and this was creating stress and difficulty for crew on board. So this told me that we would be seeing serious issues in concerns to mental health if it continued. So by late February, we began putting together material that would help the seafarer become first responders to one another. Since we knew that access to care was becoming scarce, we did this by introducing psychological first aid activities and modules that teams could tackle together. We knew that there would be no time to run workshops, so we had to be deliberate, and deliver on something that would equip the seafarer and give them the proper soft skills on board the ships. In March, we had put together a full COVID care package released to our first 200 ships with activities around mindfulness, meditations that help regulate emotions, physical exercise, and group discussions that would encourage appreciation and sharing their difficulties. In this way, we would be able to prevent the onset of mental illness like depression, anxiety, and fatigue, or suicide, by being able to bring teams together and teaching them how to respond. The package that we released also included things like identifying when someone was in distress, other basic counseling techniques and activities, and reflective exercises. My main concern was really, how are they coping? How are the seafarers dealing with the situation at hand? And these strategies that we released, the question there really was, are these strategies helping them change the way that they would cope? Because you see, if a group was showing signs of depression, then the coping would look like low social interaction. There would be, they'd probably be smoking more, there would be less exercise, and possibly very poor sleep. But the results after a 3-month period showed us that the Well at Sea program was in fact helping crews socialize more with each other. They were smoking less. In fact, some had completely quit smoking. And it actually helped them pay attention to their sleep. So you couldn't say right away if the sleep had been improved or if it was getting worse. It was half and half. But we also saw that 92% of the surveyed population agreed that the Well at Sea program had been relevant to their mental health. So we have continued on with different campaigns in the last several months, designing quality quarantine programs. This was meant for crew in the facilities in the Philippines. because crew were reporting that quarantine hotels felt like they were in jail, often compromising their mental health. And through the Well at Sea platform, we allow crew to explore psychosocial activities that they can do from their hotel rooms. We've also recently found use for these activities, the quality quarantine program, for crew who test positive on board ships and need to isolate in their cabins. Earlier, I think Sir Jun also talked about claustrophobia, and how do they deal when they're stuck in their cabin for several days and they have to isolate. Overall, we see that amid the pandemic, well at sea, we are reaching numbers as high as 75% active ships. Of course, given ship operations and all the changes, we also see 50% engagement across all of our fleets. And we continue seeing enthusiasm from the crew on board. Our solution is really meant to accompany the seafarer and teach him or her ways to approach their health on board, to develop sustainable behaviors that they can take home to family. And we are most proud of the results that we see from the many focus group discussions that we have conducted through the years. Our findings are best framed by what we call the upward spiral theory of behavior change from positive psychology, which tells us that when an environment for change is created, this builds personal accountability, group bonding, and developed skills and resources that can last through their careers. So the future of the Well at Sea program will allow us to look into mental health states of groups through open source mental health inventories that we can make available on our platform. We are already working with self-regulation inventories, fatigue, and mindfulness questionnaires that in a few months we will be able to show, it'll be able to show us, what the mental health state of seafarers were like in the pandemic. So as I come to the end of my presentation, I leave you with the same questions I started with. How are we behaving towards health as an industry? Are we simply reacting to the threats of disease, or are we ready to adopt sustainable strategies and implement full health cycles that will protect the mental and physical health of seafarers? I invite you to share your thoughts with me so we can further collaborate and move towards a common goal. Thank you so much.
Thank you so much, Gisa. It's really an admirable, innovative platform for mental health, and really looking forward for collaboration. And just a question, if we are to come up with a documented program, a harmonized program, what is it that we should ensure be part of that program?
Oh boy. Okay, well, I think that a lot of the speakers have already said, there's awareness that needs to happen, but a lot of the awareness that we do and the webinars that we do, we have to consider them as one-time events, meaning we know that after a webinar, we don't put it into practice right away.
Yeah.
So what is lacking is really how do we bridge theory and action?
Correct.
And when you take a look at the RA 11036, right, the Republic Act on our Mental Health Act, a lot of the problems there are also in the implementation, because we see actually in Section 25 on the promotion and policies of the workplace, employers shall develop appropriate policies and programs on mental health issues, correct stigma and discrimination, and provide psychosocial support. We are seeing that it's not enough to have helplines. A lot of it is really practical action, and having practical action means continuous guidance, continuously being with the seafarer. And if we can find ways to make that fun for them, the learning process, we also know that when adults are learning, we have to find ways to keep their attention, right? There's visual, auditory, kinesthetic learners. And when you have kinesthetic learners, they also have to be part of the doing. So I hope I answered your question, Ms. Preska.
Of course you did. Truly, what we need our practical actions,
Yes.
continuous guidance. We have more than enough policies, and it's a good thing that we have our Republic Act. And it's sad to note that it's not, I guess, fully implemented. Maybe because majority doesn't know about the law. So
That's true.
just like what our other speakers have said, we do need to continue the awareness, raising the awareness in the education. Thank you so much, Gisa, and very wonderful. Wonderful presentation, and considering that it is a platform, it's really innovative. Thank you so much. And at this juncture, we come to our next speaker, which I'm truly honored and I'm glad that she is giving us her time. I know she's busy, but I know that it is mental health is for seafarers is her love. So she said yes to our invitation. I am talking no less than Miss Pam Kern, the founder of Happiness at Sea. And Pam designs some maritime specific mental health prevention and intervention programs. She utilizes the synergy as a psychotherapist. She's also a former crew member and a wife of a seafaring captain, delivering real and relatable best practices unique to maritime health, mental health, and advocacy, incorporating the ship environment and home life dynamics that impact seafarers. Her programs mitigate risk and improve well-being by reducing mental health stigma and cultural barriers, increasing resiliency and the happiness. Pam has over 25 years of experience working within the cruise industry on board and in the corporate office, as well as experience working in an employee assistance program company. Pam received a Master's of Social Work from Columbia University. She also holds a certificate in business analytics from the Wharton School of University at the University of Pennsylvania. Ladies and gentlemen, let's welcome Ms. Pam Kern.
Thank you, Ms. Preska. I'm going to share my screen. There we go. There we go. All right. All right, there we go. Ms. Preska, just confirming you can see my screen.
Yes, we can.
Perfect. Wonderful. Great. Well, magandang hapon. Good afternoon. I'd like to start off with recognition to Ms. Preska Lugo, Ms. J. Pereno, Vice Admiral Rene Medina, Vice Admiral Robert Emperad, and other distinguished speakers and guests watching online. It's truly an honor to be part of this webinar, and I'm the founder of Happiness at Sea, a prevention and intervention program that is maritime specific, designed by a former seafarer, myself, for seafarers. Happiness at Sea elevates well-being as a business and people strategy. For today and for beyond. And beyond, I mean for the future of work at sea. So as my introduction, I am a former seafarer of 18 years. I had worked on board with over 90 nationalities. Most of my team was from the Philippines. I am a trauma psychotherapist, and what that means is that I counsel and provide psychotherapy for anything related to human trauma, the human trauma experience. That could be abuse, human trafficking, being held captive to accidents. I'm also, as mentioned, I'm a wife of a seafarer, so I'm very in touch with taking care of children at home while my husband is away for half the year, and pretty much everything breaking while he's gone, never when he's home. I am Ivy League trained, clinically trained from Columbia University. I have worked in the corporate office of cruise lines as well as an employee assistance program in New York City. So there are many people that do amazing things in maritime mental health. And the resources that I bring that I can say that I love to do with laser precision focus. And the first is bridging practice and policy. So as a former seafarer, wife of a seafarer and psychotherapist, I use all of these lenses to bridge the realities of practice and the realities of policy. And as a change agent, awareness of culture and how culture drives decisions and determinants of mental health on board a ship. I really focus in on culture, beliefs, and ship behavioral norms, that the norm is to always appear strong on board, or maybe it is taboo to speak about mental health from your home or your home culture. And what are the barriers to that? And the last thing is program design. I design programs that it's not a one and done program. I design programs for the continuity of care. And that is care as a verb, not just a noun. As it was mentioned by G, so well said, that after this webinar, we kind of go back to our normal lives. And where's the action? So these emojis look familiar? How many of us have used these emojis in our texts or in our emails? Shame. We all have it. It's universal, and it's one of the most primitive human emotions that we can experience. But because it's intensely painful, we're all afraid to talk about it. Same with seafarers. There is a lot of guilt and shame involved. And how can we say to seafarers that it's okay not to feel okay? And it is okay to ask for help. So one of the best practices I focus on is stigma. And stigma can come from so many different areas: your home culture, what you were taught growing up, your own life experiences, and the culture on board. And the major barrier is for seafarers, job jeopardy. Well, if I speak up, I'm supporting my whole family, my whole neighborhood, my whole community. How can I speak up when my paycheck, so many people are reliant on my paycheck? A conversation can be the start to a cure, the stigma cure. So let's start right now. For my presentation, this would be the number one takeaway. Words matter. Let's cease from saying he or she committed suicide, because this reduces the stigma, the mental health stigma, because mental health is an invisible illness. Let's say died by suicide, or suicide attempt survivor, because we don't commit a heart attack, but we can die from it. So words truly do matter. This report has been mentioned, I think, 3 times before, the ITF Yale Mental Health Study. I find this to be the treasure trove of data. If you're not familiar with it, you can take your phone to the QR code on the bottom right. It will take you right to it. This was a study of 1,572 seafarers. Filipinos were the majority of respondents. And respondents came from different flags, different types of ships, from all over the world. What I found interesting with this study is these statistics, and they have been mentioned before, that 35% of seafarers asked nobody for help when they were either screened for having depression or they felt down. And 25% screened for being positive for anxiety and depression. That's a lot. That's a huge number. 25% of the 1,572. Take that number and compare it to 6% of the whole German population, or 5% of oil and gas workers. And 11% of the 1,572 seafarers from the Pacific and the Philippines reported workplace violence. That's 4 times more likely of Filipinos reporting workplace violence than those of Western Europe. So What can we do for best practices? Best practices in having a 360 approach to include families, crew families, using digital mental health interventions that are evidence-based, using cultural adaptation specific for overseas Filipino workers that reflects morals, values, and belief systems. So for an example, a recent project that I am working on is with the Mission to Seafarers. It is a unique approach, part of their We Care program, the Onboard Mental Health Champions. We met seafarers where they are at. And what I mean by that, we didn't talk clinical. We embedded intervention in common ship stories, for instance, utang, money borrowing, and how that they can identify their emotions and feelings that drive decisions that affect the social issues they face on board. By creating this awareness, so they have got the skills and resources to make more informed decisions. Because we have to realize information isn't always transformation. So how do we meet seafarers where they are at? So we use common ship stories to embed intervention strategies. You can also check out these free resources. They're available with Mission to Seafarers on their We Care page, which is on YouTube, as well as podcasts. So here's an example of what I mean. This is the Junto Institute Emotion Wheel. And basically how this works is that a seafarer can start from the very beginning and take a look at how am I feeling right now? So let's say money borrowing. Oh, I've been asked, to borrow money. So I might feel in the center, the emotion of fear. And if you work your way out, you can then identify the feeling with that emotion, like, oh, I'm terrified if I say no, will I lose face? And then on the outer part of the wheel, am I frightened, helpless, or am I panicked? And the purpose of this is to build self-awareness over time, how situations affect our well-being and mental health. We also looked at a social issue of dignity and indignity. And we use clinical evidence-based interventions to address this. So through the officer lens, how does an officer use dignity in their leadership style? And what if you don't have your own dignity? How can you give that away to your crew? And then look at from the crew lens of how dignity affects their behavior, or were they ever treated with indignity? Because dignity is your self-worth. Respect is something different. And if you don't have your own self-worth, or you attach your self-worth to, let's say, someone else's validation, when that dignity takes a hit, you're attached to them. So how to build up your own self-worth, both as a person, as well as in your leadership styles. Going back to happiness at sea. Happiness at sea is a program that I said was prevention and intervention, but mental health still carries stigma to it. So happiness is universal throughout all cultures and belief systems. So it crosses over that barrier. So what we do is we look at the threats to happiness, which is really the threats to mental health. It's using positive psychology. It's an ecological-based program looking at the person and the environment and how the environment affects their behavior. It's strength-based, asset-based to promote well-being. So if you are from the government sector or you're from the private sector, let's talk numbers. That an EAP, which is an employee assistance program, land-based EAP programs typically produce between $5 to $10 US of ROI, return on investment per employee, for every $1 invested in the program. So if you're looking to invest in a mental health program, look at the wonderful returns you will get out of it from your value on investment, or what I call ROI, return on happiness, social return on investment, and compare that to COI, which is your cost of ignorance. If you do absolutely nothing, what would that look like? And here's some more statistics. So if employees and seafarers feel cared for through a mental health program. They feel more engaged. So here are some land-based statistics. 78% of employees are more successful, companies more profitable, and 40% more productive with a mental health program. And if you're in the private sector, your company will have 2 times more stock growth price compared to peers. And pretty obvious, 5 times less likely to have safety incidents. So what does the future look like for happiness at sea and for seafarers when it comes to mental health? Policy. Let's talk about policy being universal, meeting seafarers where they're at, and bridging policy and practice and the realities of the two. Awareness. Let's meet seafarers where they are at, not where we want them to be, but where they are at now, and then build on those skills going forward. Education, top down, bottom up approach. Meeting seafarers again where they are at, officers, then crew, to meet in the middle. And support, 360-degree support, giving support to the seafarer as well as to the families for that 360 support. And training, not a one and done program. The continuity of care, because care should be a verb, not just a noun. Because seafarers want to thrive, not just survive. Thank you. Salamat po.
Thank you so much, Pam. You have given us already your recommendation, and I have seen that you have covered the components of the program that we are considering. I am sure there are questions, so I have to move to the next speaker for us to give more time for our participants to ask questions. Thank you so much, Pam.
So welcome.
And with that, I would like to call on our next speaker from the professional, from the Philippine life coach, my master coach Adet Porto. She is a professional certified life coach since 2017 and has since then helped coaches and entrepreneurs create a life of impact with income from talents and growing in influence through the platform in life coaching. She's an advocate of quality of life, especially for people with special needs relating to mental wellness. Her mission is to build a tribe of 1 million mentally fit coaches and entrepreneurs. Master Coach A is the founder of Life Coach Philippines, the community of credentialed life coaches that offers coaching classes and services worldwide. She's also the chairman and CEO of P165 Worldwide Food and Beverage Unlimited Corporation, operating as D-Cup Coffee Republic, the coaching hub and home of certified life coaches in the Philippines. Presently, Master Coach A is at works founding the Be Learning Society to give birth to the worldwide project of building halfway house for mental fitness. Coach Adet is a graduate of economics from the University of the Philippines and studied information technology from Systems Technology Institute. Master Coach A is a wife to artist coach Danny Porto and a mother to 3 beautiful children, ages 25, 20, and 17. Ladies and gentlemen, I am proud and honored to present to you my Master Coach A.
Good afternoon, everyone. Thank you so much, Coach Preska, for the introductions, giving honor to everyone who's due of my honor, to all the previous speakers, to everyone who have spoken before me, to the people who have invited me, to everyone watching right now, joining us and locking arms in hope, in faith for a better mental health for everyone, specifically for our seafarers. Magandang hapon po sa inyong lahat. For my conversations with you this afternoon, I'm going to be talking about mental health under uncertainty. It's been almost 2 years when we have seemingly felt that the world is temporarily closed. COVID-19 have posted a very much bigger threat than ever before happened in our generation. We felt that the world is temporarily closed and decision-making has always been under uncertainty. Each and every one of us, including you, myself, even if we're on the sea, off the sea, wherever we are, I'm sure you are going to come in agreement with me that countless of decisions right now are being done under uncertainty. If you are connecting with me, I would appreciate your thumbs up on the screen and also your connecting words in the chat box. Maraming pong salamat. I am coming from the emerging new role in the society and business, which is a life coach, and Coach Preska have done a lot of introductions. Thank you so much for that. And I am here to share with you what we can do, what we can share in this area of expertise. Decision making. Right now, if you look at the quadrants and the strategy that we are making decision under pandemic, we are making high stakes and uncertain decision. And when we're making decisions and things are certain, we know that there's a lot of stress. The stakes are going up, considering that the pandemic continues now on year 2, and there are more long-term implications for everyone. Each mind matters, including our seafarers. And if we could just imagine and have a picture of how they struggle mentally, I would like to share with you my mental picture of how they struggle. It looks like this. Maritime Seafarer blog have posted this early this year. 10 facts, fascinating facts about the maritime industry. On its number 5, it stated, here's one fact that probably won't surprise you. Almost every nationality on the face of planet has someone crewing on the ship. Let's break down a little further the numbers, and it says approximately 1.5 million seafarers working in the shipping industry worldwide. 98% of those are male and 2% are females. Now here's interesting. Filipinos make up a third of all the crews, with almost 250,000 at the sea. Therefore, the average crew member is a male Filipino. You and I can understand what this truly means. And truly, it's very fortunate and it's very timely that Marina right now is putting a lot of endeavor and effort in what we are facing, not just as an industry, but a global at stake for what it is happening right now in the seafarers industry. While there's a continuity of the industry, in fact, this industry becomes even more at large, growing, and much needed. There are top 5 decisions to make for each and every seafarer that we have. I'm not going to be talking about highly empirical based results. I'm going to boil it down to what exactly are the top common big decision, seemingly simple, but very much tasking in the mental health of our seafarers. Top 1 would be contract extension. We know that when the pandemic hit, a lot of our seafarers were made to stay on the ship. There were extension because there cannot be a substitution, or there are a lot of changes that happens. And a lot of seafarers may say yes because they didn't have a choice. Second, contract renewal. For those who are asked to renew, will I renew? At the midst of pandemic, a family member suffering, them suffering, people, friends dying, will they still be renewing their contract? Will they still get on board, back on the sea, not even knowing when will the best time for them to be back? Getting on board is tough. for those of the seafarers who finally get down, reunited with their families after all the tasking quarantine procedures and processes and workups that they have to go through, will they still get on board, considering the need not only of our country, but the global economy? With that comes on the fourth. What are their health prerogatives? We've known people who suffered on the sea, on board, but cannot be given the right attention because a lot of things, a lot of considerations. Pandemic is pandemic. What are their health prerogatives? That's very tasking. What if something happens to me? What if something happens to my family? What can I claim? What can I be given? And how fast can it be given? And of course, the last of these top 5 decisions would be their financial decisions. Some of the previous speakers have already taken considerations. Many of our seafarers are taking the load of the budgetary requirements, not only of one family, but many families. With these top 5 decisions to make, I'm not saying this is exclusive. Of course, there's inclusive, there's a lot more. But take a look at these 5 tough decisions to make every single day that is common. I believe if you know one seafarer, at least one of these top 5 will be concerning them. At the minimum or at the average, there will be at least 3. They're concerned of their health, their finances, and whether they continue, will they be extended, or will they really get on board or end their career as a seafarer? We are cheering for them. You can do it. We can help. We've been saying that all over the place, and I'm sure we are all well-meaning to say, we can help. You can do it. We say, we can help you. But then again, these words could mean empty promises for people on the ship, for families waiting, not understanding what's going to be the future of this industry, especially in terms of mental health. Your families, the people on the sea, everyone else in the industry goes through this. What can you do? For us, in Life Coach Philippines, in our organization, we promote and we advance think safety first. If you are feeling that there are challenges in your mental health, that there are things that concerns you mentally, that we go through this and say, first, connect with a service provider, professional service provider. It's not safe to assume, it's not safe to self-diagnose, which is very common to people who seems to feel that they don't have an access to mental health services. When you feel anything that is not usual, connect with a professional mental health or at least a service provider who can assess you. Complete medical assessment is needed. Some of the symptoms that people would say related to mental health have proven to be related in other sickness, like goiter, like hypertension, like heart diseases. It kind of mental health, it looks like mental health, but if you go down it, go through it, it's not mental health. But because people are scared to go through the assessment, they assume they are mentally challenged. So go through complete medical assessment. Number 3, whatever the medical results that you're getting, hire a professional service provider. Here's where we really come in very strongly, because countless of people, when you talk about stigma, are not ready, not willing to get into the psychotherapies, to the psychiatrists, and even to psychologists. Professional life coaches knows the boundary. And we are one with you, partnering with you to help our people understand the need for professional service, especially the medical area, if it's needed. And this is where we help people understand it's okay not to be okay, but it's not okay not to get help. And much more, it's not okay not to get the right help. So if you're working with us, this is one area that we strengthen and empower people. We help them make the right decision for their mental health. Establish a network of support. Mental health is not a verdict of life. It's not an end. It's not an end. It's not an end. Get it from the heart. It's not an end. You can get better. And with the right support, with a positive environment, you will get better and you can heal. Start a program of transformation. The previous speakers have already spoken about happiness, wellness at the sea. What can we do to start habits, becoming happy, like happiness, becoming joyful, becoming empowered to take actions, even if you are far away from the land and from the shore. And finally, we advocate that you incorporate mental fitness with your workflow. These simple steps will definitely get you going at the onset. As for us, as an organization, we have Decaf Coffee Republic. This is a coaching hub, and we offer this as not just for the people on the shift that you can connect with us. This is also available for your family members here in the Philippines. We offer 24/7 coaching services, and you don't even have to worry about your finances because we offer complimentary services. So if you're worried, just get our number, connect with us. We have Life Coach Philippines, our banner organization providing coaching services, coaching classes, coaching workshops. We've got my personal page that offers services on business, mental health, and personal encounter where you need a customized package for what you need. And finally, we've got a community that supports and advances mental health. All around, all across the globe, we talk about strengthening our immune system. 7 ways you might be harming your immune system. And one speaker earlier have already mentioned this, and many of you would agree that 7, like almost all of this, would be available with our seafarers. I'm sure you can connect. If you are, and you're brave enough to connect with me, put me some emoji on the screen. Let me know in the chat box that you are connecting. Life coaching can help you with life transitions, optimal performance, career planning, change habit, health, and wellness. But here's where I truly want you to understand. We offer you coaching-based intervention program. Awareness is key, intervention is needed. We offer things in 4 ways: physical, mental, spiritual, and emotional. If you are interested, we will be very willing to discuss with you this in detail. COVID is still here. We have seen the first order effect of confusion, people asking what next, what can I do, how should I respond? The second order effect is happening right now when people are making the decisions on 4 quadrants. Things they know, they're aware, and they understand. They can make decisions on that. But they're also making decisions on things we are not in awareness. Things we are unaware, but we don't understand. Things that we are neither aware or nor understanding. And the last quadrant is things we understand, but we are not aware of. This is happening right now. And this will continue because pandemic is still here. And what will happen on the third impact effect will be affecting primarily the mental health of many individuals, most especially the people on the sea. Mental disorders are not adjectives. It's not something that here today, gone tomorrow. If you are living right now in an immune stress vicious cycle, please know you need help. Help is available. Let's get into partnership to keep everyone sane, especially our seafarers, these heroes on the sea. We have created this community, private community, Seafarers Talk by Life Coach Philippines. And if you are interested, you can join, you can come in, and we have a lot of programs. This is free to join. We have a lot of programs at stake for people on the sea that we believe we can do our share to advance mental health. Mental empowerment amidst pandemic. What can we do at the very least as we part ways today? I encourage you, develop an attitude of gratitude. This is free. You don't need any mental health practitioner. You don't need any professionals to help you. You can get this started right now, right here. It is not joy that makes us grateful. It is gratitude that makes us joyful. And if your heart is joyful, if your heart is happy, if your heart is full of positivity, then you can fight the pandemic because your immune system will also be strengthened. We are people helping people. Help is available. 0917-586-1661 is the number to call. Stay connected and we'll be glad to discuss with you very specific programs for very specific needs. Maraming pong salamat to everyone here on the space and to everyone who's going to be watching this on a replay. I encourage you, let's do a share. We live just once and let our lives count right now, especially during this time of greatest need in our history. Thank you so much, Marina, for the invitation.
Thank you so much, Master Coach. So much have been said, but what came to mind though is the attitude of gratitude. Truly, when we have that kind of attitude, notwithstanding what is happening around us or in us, we feel empowered. Thank you so much, Master Coach. Because of element of time, I know you have questions. But anyone who would like to ask a question from our participants? Because I have one question that I request each of our speakers to give to answer. I have been hearing since the start of our webinar that we need to talk about the issue of mental health of our seafarers. So therefore, and then there is a word given that we need to destigmatize. Now the question is, how can we destigmatize mental health issues of seafarers? Maybe in 1 minute, you can share your thoughts on this. Let's start from Miss Rubelin is still here. Okay, sir, Sir Dito, maybe you would like to start.
Well, our various panelists have shared various approaches to addressing the matter. And, maybe we can better understand it if we don't highlight just our seafarers, but we look at ourselves and start by looking ourselves in the mirror. What problems do we face every day? And when we can begin to understand our own selves, we will begin to understand why others also have the problems, because all of us suffer from stress. And when our various speakers talked about the fact that it's okay to not be okay, then what we should probably do within our own organizations is reinforce the ability to share and feel comfortable with each other. The challenge, of course, in doing that, it's easy to say, let's make it easy for us to share. But in many of our organizations, the challenge is it's a rat race. It's who can get on top of everyone else. And so oftentimes, because of that type of an environment, the tendency is not to help each other, but rather isolate one another whenever somebody is weak. And you know that the strength of any organization is its weakest link. But if we can help the weakest link, then we're also helping each other. So unfortunately, when you have these particular situations or conditions, there's an element of embarrassment. And so I think that if each one of us who are present in this discussion today can just decide that, number one, let's look at ourselves and what would it be that will help us? And as we figure out what it will take to help us become better, let's turn that around and say, well, then what should we do for others to help them become better? And that could be the first step in trying to engage. And I think the most important thing in all of this is let's engage with each other, even just on a one-to-one basis. Because if I can help somebody, or I am ready to accept help from somebody else, then that's the first step to getting this whole momentum or movement through. Once we do that, then we can try to remove the embarrassment. And it's whether you talk of mental health or any other kind of problems, we are only human. We don't want to be embarrassed. So how do you create an environment, whether it's on board a ship or in your office, where sharing and providing support will get everyone to feel more confident about working as a team? That's one reason why we called our project with the Synergy Marine Crew, We Team. Because at the end of the day, it's not about me, it's about we. And what I have come to realize in my own work experience is that I'm only as good as the ability of all of the other people who I work with to do their jobs. If each one of us think that we are the only important person in our organization, you might succeed today, but tomorrow you'll be far from success. And with such competition around us, we need everyone. It's an all hands on deck requirement for us to succeed. Life is getting more complex. And because life is getting more complex, there's more pressure. So we need each other. And if we can begin to break down those barriers of the me situation, creating the we and understanding that the team is what is most important, that probably will help. But it's easy for me to say that. The hardest thing for us to do is practice it. And so by the sharing that was done by all of the different speakers today, I hope that we can all begin to think about how do we break down those barriers. And you take one step, it's a journey, but one step is a step closer to getting this movement going, and realize that it could happen to any one of us. And whatever happens to us, we should be prepared to help others so that we can break down those barriers. But I mean, that's my take on it, Preska.
Thank you so much, Sir Tito. Yeah, it's just like saying, together we can, but we have to start from ourselves. May I call on now Ms. Robilin, please?
Okay, I agree with Mr. Borromeo that with this gathering this afternoon, it's helping everybody to destigmatize those seafarers who are listening now that they are aware, and that they know very well that it's really okay not to be okay. I think this is part of our first step. This brings us a positive note on the challenges on how to make everybody aware and aware of mental health and its importance. So this is a good start to help everybody, and a good way for all of us to be aware and be educated. So I agree with my fellow resource speakers that this venture, this juncture of MARINA will indeed help everybody. Thank you, ma'am.
Thank you, Ms. Robilin. Yeah, awareness, raising the awareness would really help. Now, may I go to Pastor Jun, your thoughts on how can we destigmatize the mental health issues of seafarers?
Yes, I really agree with this distinguished speakers, and I'm really a fan of what Sir Dito said a while ago, that I think self-awareness is much important before we could help other people. And by having this self-awareness, if we are, ourselves are maintaining a good mental health, then possibly we can avoid, we can communicate to the people and somehow guide them not to be judgmental. Because that's most of the part why most of the Filipinos or most of the people, why they don't want to discuss about mental health, because they don't want to be judged by other people. So So I think self-awareness is a big part of this stigmatizing this issue. And I really agree with Sir Dito and the tagline that we is more important than me. So yeah, that's part of being non-judgmental. And I think talking more about mental health will really help to to bring awareness to the seafarers. And the more they talk about mental health, the more they talk about themselves and how they could cope and what are their problems, what they make them worry. The more they talk, the more they become aware of themselves. So I think that's that as I observe many of the seafarers, that they because of this macho image in the industry, they are really afraid of talking about this issue. But sending the message that it's okay not to be okay, the tagline is a very good one. And sending the message that if they feel not okay, it's okay to talk, to discuss this, or to ask somebody for help. So I think, Ma'am Presi, that's what I think that can contribute to for this issue.
Thank you so much, Pastor Jun. And Jissa, your thoughts?
Okay, yeah. So when we define stigma, stigma is a mark of disgrace. Kumbaga sa Tagalog, kahihiyan. Right? Pag may kinahihiyan tayo, when we are ashamed of something, how do we break that shame? Part of breaking that shame is addressing the lack of education around the complexity of mental health and disorders. And perhaps that's where we should start, because understanding its complexity, look up the diathesis stress model, we will understand why something may be stressful to one person, but it may not be to another. And it's the exact same situation and experience. Perhaps by understanding the complexity of the disorder, we will be able to remove the stigma, remove the mark of disgrace, and remove the feeling of hiya.
Yeah, true. That feeling of hiya is really something that keeps us from asking for help. Thank you so much, Jisa. Pam?
The three words that come to mind when destigmatizing mental health is guilt, shame, and vulnerability. Those are the three words that are very hard to express. So destigmatize, let's normalize. Let's normalize guilt, shame, and vulnerability so we can go over those barriers and look at mental health as a natural extension of our overall health. This hopefully will change the person and then the environment, because if we give all the resources to the person and the environment still stays the same, which is the macho stigma of always appearing strong, what good does that do? We need to change both components, the person and the environment, to shift the environment to a more positive way of looking at mental health. And reaching out, as Dito said, about sharing. Sharing is caring. And asking somebody, are you okay? Can you imagine the tremendous relief of the person that you asked, that, wow, somebody mentioned it first, so I didn't have to. So being aware of others out there. And I just leave it with the best strategy is sharing is caring. Thank you.
Thank you. Thank you, Pam. And may we hear now the thoughts of Master Coach A.
Right. Every speakers have shared a lot of things that's very vulnerable. Vulnerability is required. Like everything that they have said, with its all values embedded in it, inherent value, it takes vulnerability to practice. From my end, I'd like to say that, like in anything in the world, everything comes inside of you. Success is always an inside work. including our mental health. So from the practitioners and the recipient of the practice, the recipient of the service, success in our mental health will always come from within. And when we talk about something from within, I'd like to focus on the word respect. We as practitioners, we hold a safe mental space for our clients, for them to express, for them to share what they feel. We do that. Unfortunately, we also see that the people who needs help at many times miss the fact that they have to respect their own situation. And what does it mean? Respecting your challenges, whether mentally, physically, spiritually, or emotionally, means that you speak and share your challenges with the right people at the right time. We promote and advance healthy conversations, safe conversations. But if you are making the conversations with people who are not aware or ill-equipped to handle your mental health situation, oftentimes it will aggravate your mental health. It's okay to share how you feel, but at many times you feel that you are not getting the right support and help because probably the person listening to you don't know any better. When you respect your mental health, when you respect your condition, your situation, your challenges, you know that you will only talk to the people who can give you the same respect to what you are being challenged about. A lot of people will talk about mental health, and I'd like to say that today we have heard people who knows exactly how to help you, and I'd like to advocate further that we get into the space where we get help, we get support from people who knows how to help. Not just to give you the compassionate words, not just to, make you feel good. It's good to feel good, but it's best to get the right support and help. And it starts with you respecting your condition, respecting the people who can help you, respecting the space. We can all be vulnerable with the valuable resources, service that you need. That's for me.
Thank you so much, Mr. Coach A. It's really an overwhelming day for us. I guess in a sense that we have received a lot of inputs and we need to process them. And I would say this is just the beginning. And the beginning of raising awareness of the mental health issues among seafarers. And before I go any further, I would like to acknowledge our dear administrator who is now in our meeting room, sir. We would like to thank him for initiating this activity. Indeed, if we want to have competent seafarers, we need to look into their well-being. So that said, I know you have a lot of questions. Don't hesitate to send them in the chat box, or you can email them to us, and then you can also connect with our resource speakers here. But since we have actually exceeded the time, I would like now to move on to the next part of our program as our way of acknowledging and as our simple way of expressing our gratitude for the time, effort, and the expertise shared with us by our speakers. In spite of their busy schedules, they came over and joined us to this very important webinar. So kindly spotlight our administrator for the awarding of certificates. I will just read the content of the certificate. We will email this. This is a virtual activity, and the awarding is also virtual. So let me read the text of our certificate of appreciation, please. Next slide, team. All right. So we would like to, as a simple token of our gratitude to our speakers, we would like to present this certificate of appreciation for sharing his or her invaluable insights and perspectives, as well as best practices during this webinar on seafarers' mental health, held on 23rd of September via Zoom online platform as part of the celebration of the Maritime and Archipelagic Nation Awareness Month and the National Maritime Week for the year 2021, given this 23rd day of September 2021, Manila, Philippines. Signed, Vice Admiral A. Empedrad, our administrator. And so at this juncture, I would like to call on now Sir Vice Admiral Empedrad for his closing remarks.
Yeah. Thank you, Preska. Can you hear me?
Yes, sir. Yes, sir. We can hear you.
Thank you for your introduction. So today, first of all, good afternoon to everyone, to all who are attending our webinar on seafarers' mental health, and our guests who came over to share us insights of their expertise for the benefit of our beloved modern heroes we call our Filipino seafarers. Good afternoon to everyone. Today, we have just added value to ourselves by learning to care more about our seafarers, our modern heroes, who have struggled with mental health issues due to extended time aboard ship, especially amidst this time of COVID-19 pandemic, which allows them to stay a longer period aboard ship. My beloved countrymen, please allow me to wrap up things up with an expression of gratitude and wholehearted appreciation to our dear resource speakers and those who have actively participated in this seminar or in this webinar. For giving us an in-depth look on the issue at hand, I would like to thank Ms. Robelyn D. Lumampao, psychologist, mental health advocate, and AMOSUP representative, Regional Director of the International Seafarers Welfare Assistant Network, or ISWAN, Mr. Jun Pablo Jr., Chief Executive Officer of the Philippine Transmarine Carriers, or PCC, my good friend, Sir Gerard Borromeo, the CEO of Well at Asia, Ms. Gisa Paredes, founder of Happiness at Sea, Ms. Pam Kem, and Master Coach Adet Purto of Life Coaching Philippines. Please know that we, as a unit, will never put your efforts to waste and certainly follow through by mastering our devices in the service of the Filipino seafarers, particularly their well-being, all for a healthy and productive maritime industry. With our country, the Philippines, being widely recognized as a maritime nation, we have it on our shoulders to consistently step up and strive to be a global leader and catalyst to propel this industry, particularly the seafaring industry, forward. And with you, our dear resource speakers and participants on our side, I am confident that we are on our way to doing just that. You are a blessing to all of us here in the Maritime Industry Authority. To the men and women behind and who serves as the organizers of this webinar, my salute to you. Thank you for facilitating and coordinating all the discussions and activities in this very noble seminar or webinar. I am impressed by your commitment to staying true to our common objective of further improving the well-being of our seafarers despite the ongoing pandemic that affects every one of us in the Maritime Industry Authority. To our leaders in the Marina, our very own Deputy Administrator for Operation, Engineer Ned Dinopol, the OIC of the Deputy Administrator for Plans, Tony Jun Pia, and of course the Executive Director of the STCW Office, Vice Admiral Rene Medina, who spoke for our opening, for our earlier message, and of course Captain Jeff Solon. Thank you for your initiatives in making this very insightful webinar possible. Now it has been made clear that every one of us are capable of helping in addressing the welfare and the well-being of our Filipino seafarers. I am looking forward to seeing our seafarers take great benefit from all of this. Special mention goes to the participants of this webinar, our stakeholders, the LMAs, our maritime and seafarers organizations. Thank you for your genuine concern for our seafarers and the people and the industry as a whole. You played a vital part in putting this issue in our scopes. To the officers and members of seafarers associations and the seafarers who are in attendance today and even yesterday, you have made this webinar interesting and productive through your active participation. We wish you all the best in your undertaking, and may you be a beacon of hope to your colleagues who are mentally and emotionally afflicted. If you are suffering yourself, I hope that this webinar has somehow shed light into understanding your personal afflictions. Know that there are more people who are more than willing to help you get back on your feet, people who will listen to you, to your pain, and most importantly, pray for you. People who are here to serve you, the personnel of the Maritime Industry Authority. Your valuable inputs in today's virtual webinar will help us frame up a harmonized mental health program for all our seafarers with regard to the policy, raising awareness, education, training, and support system. Putting in place this program is our practical approach to improving seafarers' well-being, mental health, having recognized them as our modern-day heroes, our essential key workers. As I end, may I express my deepest gratitude to each and every one of you. I hope that you share with others what you have learned today. Tulong-tulungan po tayo. Let's look and care for each other burden. Let's support each other burden. For in this way, we can be a great seafaring industry, a great maritime industry, and a great archipelagic nation. Again, thank you very much at mabuhay ang ating marinong Pilipino. Magandang hapon sa ating lahat.
Thank you so much, sir. Indeed, this is just the beginning of more activities like this, and we're looking forward for the program that we were talking about, and what our speakers had given us are truly invaluable. Would like, before we end, I would like to encourage our participants to please do fill up our evaluation form. It is in our chat box. And let us end with a photo session. Sir, kindly join us. So team, let's have a photo session first. Okay, there. So we still have 6 panels. We would like to encourage everyone to please turn on your camera for our photo souvenir photo, sort of. Okay. Team who's taking the screenshot? Team?
Ako po, ma'am. Yes, ma'am.
Sige. Give us the signal.
Okay, ready? 1, 2, smile.
There are 6 panels. Do not stop smiling because we don't know which panel we belong.
Next po. 1, 2, smile.
Okay.
Panel number 3 po. 1, 2, smile.
Yeah. 4. Wala nang tao.
Okay na po, ma'am. Press ka.
Okay. All right. Thank you so much, everyone.
Thank you.
Stay safe.
Thank you po.
Thank you po.
Thank you very much. Thank you, admin.
Thank you very much. Thank you, sir. Sir. Sir Borromeo, sir. Good afternoon.
Thank you.